So if you want to do a sleep apnea device and submit it digitally, the software, if you're using the CEREC OmniCam that you want to use, is the Connect software version 5.1. You'll know it's 5.1 because it has a white screen. It doesn't have a blue screen. And what we're going to want to do is enter our patient's information. It's one of our doctors here, so she has already been scanned before. We're going to go ahead and add a new case, and we're going to walk through the entire process. Okay. So when you look at the screen, there's a few different options. We can do a crown, we can do bridge restorations, or we can do a jaw scan. When we look at impression, aligner, splint, and impression tray, the main differences on all of these is when we actually get to the Connect screen, which we're actually not going to use, they'll give us different options for how we want to export it. If it's impression, it's going to give us STL, and then hopefully one day like PLY and OBJ images. Aligner, it'll give us different export options, different companies, whether it's clear correct or different clear aligner fabrication methods. If it's a splint, it'll give us different lab options. It doesn't really matter which one we choose. I usually choose either impression or splint. And then what we're going to do is we're going to go ahead and click next. And we're actually going to click or toggle this full arch scan mode. So what this is going to do is have us start in one quadrant, scan the lingual, scan the occlusal, scan the buccal, and then stitch everything together with a canine roll in the area where we'll get twist of our impression material. So we'll go ahead and we will start the scanning process. So for the scan, what you're going to need is you're going to need a George gauge, a bite fork, an obtrugate, or this contraption, which is our first time using it, so we'll see how it goes. And then we also need our mirror and explorer if we have to get the tongue out the way. We also have an extra pair of gloves here, which we do not need. All right, perfect. So we're going to go ahead and we're going to get started. You can take the mask off, Dr. Dainty. I want to put your glasses on for us. And they are still a little wet from being wiped down, so I apologize. All right. Well, it looks pretty simple to put in. Looks just like a NOLA dry field without the sections, so I think we'll be okay. All right.
You need light?
No light, nope. And so this scan should take us maybe about 10 minutes maximum. And it should have cross-arch accuracy, probably somewhere in the range of probably 80 microns when it comes to the cross-arch. And then when it comes to tooth, it should be somewhere about 35 microns. So almost just as accurate as a PDS impression. All right, we're gonna go ahead and put this in. All right, and hopefully your tongue finds a little basket.
Mm-hmm.
All right, let's go ahead and try this again here. This should go in your cheeks, correct? Mm-hmm. Hold your cheeks out the way. Mm-hmm. All right, excellent. Excellent, yeah, looks pretty nifty. All right, so we're gonna go ahead and, as I'm working. So what we're gonna do first is start on the lower right-hand side. Okay, and I always start on the occlusal aspect if we can. And then I'm gonna roll towards the lingual. And we're gonna hold for 3 seconds. Okay, we're gonna come back to the occlusal again. We're gonna pull this out the way. Okay. All right, now we're gonna roll down towards our buckle and turn our camera to the side. Okay, now we're getting our canine roll. Okay, perfect. We got that side right there. Same thing over here. And I'm sorry, this is torture you, Dr. Dainty. This thing's pretty slick, Dr. Hanson.
Yeah, I think they were good.
Okay, stitch our images together there so everything looks good. All right. Close down just a little bit, okay, perfect. So I'm just turning the camera ever so slowly. Whenever we rotate the camera angle, we want to make sure we do it very slow so we don't mess up our image stitching. She has very shiny teeth, so what we may have to do is degloss them with a little bit of the Cerac powder. So the next step we're going to do, we have the Opti spray. So we're going to go ahead and pause our camera for a second. And what we're going to do next, so if you look at this screen, we're going to kind of zoom you in. We're missing a couple areas right here and right here. Now, for making a removable device, something like a ProSomnus, is it imperative we get these areas? With a digital scan, it's going to stitch a lot of this image together for us anyways, using Sirona's algorithms to fill in some missing data points. But this powder will help us kind of capture some areas that we may have missed. And it's going to make our buccal bite a lot easier. So when we use this Cerac Opti spray, what we're going to do is hold the low back section in our patient's mouth and hold it over to this side right by the cheek. Right there, perfect. And this is going to prevent this titanium dioxide powder from going all over the place. And just a really, really light coating is all we want to do. And now we can go back in and we're going to scan just a couple of areas of missing data. And you'll see how quickly it'll stitch information that may be missing. Close down just a little bit more, Dr. David. There we go. Excellent. All right. Perfect. There we go. I'm just doing one more sweep just to make sure we got everything we want. All right. Perfect. Now, if you go back through, you can see very minimal to no missing data whatsoever. So very accurate scan. Now we're going to go ahead and move to the upper jaw. Okay, so the upper jaw, a little bit of airfoil, Miss Flores. Perfect. Okay. Now, if you want to start from scratch and use the powder for your entire scan, you can if you have good isolation. So I'll show you how much quicker the rest of our scan is going to go. So hold that low back section in for me really quick. We're just going to degloss all of Dr. Dainty's teeth. There we go. So now, let's go ahead and you'll see how quickly this image stitches together here. Much faster I can move the camera. Okay. Close down a little bit for me. There we go. A little bit of airfoil back there, Miss Flores. This is just getting her cheek out the way. Perfect. Good. Now I'm going to roll the camera around. There we go. Do our canine roll. Okay, good. All right, same thing on this side over here. Now you'll see with this powder, that makes very quick work of our arch. Sometimes the computer won't even have time to catch up by the time we're ready to start scanning. There we go. Open a little wider for me. There you go. Excellent. Great job. Okay. Now I want you to close down and slide your jaw to the left for me, ever so slightly. Perfect. That's going to allow me to get back here and roll this camera up to get this spot. Perfect. Now we're going to rotate our camera around. You can relax your jaw. There we go. And now, you'll notice with the powder, we should have a lot less missing data. Everything is almost perfect. Now, the only thing I need to do is to really make sure we get a nice image capture. We're going to rescan this upper right-hand side. So what I want you to do is slide your jaw to the right for me. There we go. And just kind of hold it. And a little bit of airfoil, Miss Flores. So we're going to defog our camera. There we go. Excellent. All right, and that right there should be enough image for the camera to digitally remove that when we move on to the next screen. Okay, so this new software does a really nice job of removing cheeks and soft tissue. So now what we're going to do is we're going to go ahead and pop this contraption out of your mouth here. And we're going to put in the George gauge. So now when we put in the George gauge, it's not super important which overall fork we use, if you notice, one of them has a number 2 on it for a 2 millimeter opening. One has a number 5 on it for a 5 millimeter opening. I don't think we have any of the 5 millimeter. Ooh, we do have one. Perfect. We have one 5 millimeter bite fork. I like to use the taller bite fork when we do these types of restorations. When we send to prosomnus, the wider we have the jaw open, the less likely their virtual articulator is going to have a posterior interference. So if we can, we use the 5 millimeter bite fork as opposed to the 2 millimeter bite fork, which you can see is up in this incisor area here and here if you compare them side by side. So we're going to go ahead and put the 5 millimeter in. Okay. We're going to lock in the lower incisors. Now, if I was doing this with PVS, I'd actually put a little PVS down here to get a more accurate and lower incisor kind of reproducible position. All I'm capturing for this is just her protrusive record, okay? So go ahead and slowly bring your lower jaw forward slightly for me. Bring your lower jaw back a little bit for me. Open a little wider. And let's try this one more time. And what I want you to do, 1 second here. All right, go ahead and close down gently for me. Perfect. And so you look here, we're just making sure her lower jaw is symmetrical. We're not forcing her jaw one way or the other. I'll make sure that my bottom thumb screw is tightened. I want my left or top thumb screw to be loose. So what I want you to do, Dr. Dainty, is go ahead and slide your jaw back as far as you possibly can. Okay, so we're at +5 all the way forward for me. And 7, okay? Slide your jaw back. So 5, slide your jaw forward. 7. One more time. 5 to 7. So we have 12 millimeters of movement. We know we want to be somewhere around 50 to 60% max protrusion. So go ahead and slide your jaw ever so slightly forward for me, and I'll tell you when to stop. Stop right there. Perfect. All right, so that should put us somewhere around 50%. And when you look from the side, she's pretty much edge to edge. So I'm going to take this out really quick, Dr. Dainty. Close your teeth together for me. And we can edit this out of the video if you want. But I want you to try to make the snoring sound as loud as you can. Perfect. Try to do it with your mouth closed. Try to make the snoring sound. Perfect. Okay. So now what I want
What's the point of that?
I'll show you. So now, just to get it on video, really. All right, so now try to close your lips around this a little bit. Okay, now try to make the snoring sound again. Okay, what I'm gonna do is slide your lower jaw a little bit further forward for me. I'll tell you when to stop. Stop right there. All right, slide and go ahead, and I want you to try to make the snoring sound again. Is that harder for you to make the snoring sound now? Mm-hmm. All right, I'm gonna try one more time. Go ahead and slide a little bit further forward for me. A little further forward, and stop right there. And go ahead and try to make the snoring sound again. A lot harder, right? Mm-hmm. Open up for me. Do you feel like you have to really kind of force it to try to make the snoring sound? Yeah. Okay. So we could go all the way to +7. So right now, if you look at it, we're about 8 millimeters of movement. We have overall 12 millimeters of maximum mandibular movement. So did that feel like it was stretching your jaw at all, or not necessarily?
The 7, all the way forward, yes.
Okay. What about this one I just had it at, where you were trying to snore?
I mean, it's not like super comfortable,
Okay.
but it's,
Well, let's do this. Let's move you back a little bit. Okay. I'm going to try kind of bringing you back ever so slightly. Go ahead and slide your jaw back just a little bit. Perfect, right there. How does that feel to your jaw? Thumbs up, thumbs down, or kind of thumbs up? Uh-huh. Okay. Let's go ahead and we're going to scan you right here, okay? Because this is a little bit beyond edge to edge. We still have 3 millimeters of movement, so we're not going to bring you to 100. Even if we bring it all the way, we'll still be about 80 to 85% maximum protrusion in our initial prosomnus setup if we take our initial tray 0 at this position. So what I'm going to do here, okay, is we don't need any sort of bite registration material. All we're going to do is go over to buccal bite. There you go. And take a look here. There we go. And same thing, I'm just going to pull your cheek out the way ever so slightly. The hardest part is trying not to bump my George gauge. That's it. And it accepted our bite as an open protrusive record.
It looks like the midlines are on.
Yeah, everything looks good. So now what we're going to do is we're going to go ahead and go. So now when we look ahead, all of the models have been entered in. What I'm gonna do to make the ProSomnus Tech life easier is I'm gonna go ahead and make my models pretty. Okay, and the way I'm gonna do that is I'm gonna go ahead and use the cut function. And we'll go ahead and remove all of that tissue there. Same thing here, double left click to start, single left click to get all this out the way. And what this is doing, anytime we try to flatten a model and we have less kind of coronal apical position and mesial distal position along our bases of our mesh, there's less work that the computer has to try to do to fill in this mesh work in their digital planning software. So I'm just trying to make it nice and flat, and it's going to reduce the amount of resin that they have to print. Now with ProSomnus models, we typically don't involve much the palate. So I'm going to go ahead and kind of make almost a horseshoe type model. Remove this area of rugae that it didn't capture. Okay, perfect. Now when you look here on our Sirona scan, you can see that it filled in some areas on the posterior. Am I overly concerned about that? Absolutely not. Sirona uses an algorithm that catches your marginal ridge, and it actually makes it slightly larger, so that way when you actually make your digital device, there'll be a mild almost space, almost like an increased spacer thickness between your tooth and your whatever restorative device you're making. So for ProSomnus, if I have one little area missing on a distal lingual corner or a distal buccal corner, I typically don't get too bent out of shape about it. As long as everywhere else we don't have any major missing data points, this is a very acceptable scan to send off to ProSomnus. Now we're gonna do the same thing on the lower jaw. Again, to make our tech's job easier at ProSomnus, we're gonna go ahead and remove any areas that we don't need. All right. All right, same thing here. Now we want to make sure we leave a little bit of gingival tissue around the teeth because sometimes they go into a model edit function in a third-party software. The closer we get to the teeth, the less room there is for their tech to work. So we're just going to make some minor cuts. And now if you notice, when we use the cut function, and let's say I hold my left click and try to move, do you see how the model is stuck in one plane? Whenever we're using the cut tool, you're locked into whatever plane you start your cut in. So if we want to cut in a different plane, we rotate our model and we make our digital cut here. Okay, last thing we're going to do is get rid of this data right here that we don't need. There we go. And then let's make our turn. Perfect. All right, so now very minimal data that ProSomnus is going to have to digitally remove themselves. We're sending them nice, clean models. So here we go. All right, so now let's check our buccal bite registration. Now when you look, you can see Dr. Dainty is pretty much an anterior, almost edge-to-edge position. So being edge-to-edge, assuming she has a normal class 1 occlusion, we're actually going to be a little bit beyond that 50% mark of protrusion because we kind of have to jump that gap from the lingual of our central incisors to be slightly beyond. So, which is what we see, we're at about 60% in the protrusive record we took. There's no need for any sort of PVS like Blue Moose, because you can see as long as the computer can stitch the top and bottom together, there actually is no torsion to our models whatsoever. If we look at our midline's lined up nicely, which is something you can't actually see when you send an analog model off. You just have to verify with the George gauge in, which sometimes can be very difficult. Overall, I'm happy with how everything looks. We're not going to use the connect screen. At this point, we're going to go ahead and click on the Densify icon in the corner. We're going to click export. And now we're going to export the highest resolution STL file. And what we're going to do is just put it right on the desktop. So that way we can use whatever media transfer modality that we use. Here we can use Microsoft Teams because it does actually have an emergency approval from the DoD to do PII and PHI transfer. for telehealth reasons. So we can use Microsoft Teams, we can use we can use DoD SafeSite, or if you have the ability to use removable media, we can export this with a thumb drive as well. If this is going to go to the Army Dental Lab, and they're going to see it before ProSomnus, what we can also export as is a DXD model. And what the DXD model will allow us to do is if the ADL wants to make any modifications for any reason, this DXD will allow them to take this to the Dentsply Sirona in-lab software if they want to close off our models or base our models.